DHSS Secretary Walker, and she is still, I guess, relatively new in her job, but it has been incredibly valuable to us to have her on the job. One of her main focuses from day one has been on the quality of medical care that is involved in substance abuse treatment. And as I mentioned, the numbers, 6,000 people receiving treatment, doesn't really fully state the problem, because treatment is still not what it could be. And we are very grateful for her focus on not just providing numbers in treatment, but also providing quality treatment. So we thank you very much for your involvement, and turn things over to you.
Thank you so much for the opportunity to be here. We want to express our gratitude to the Department of Justice. Thank you so much for the interest and work on this important issue. Addiction is the public health crisis of our generation, and we know it's taken far too many lives, impacted far too many families here in Delaware and across our country. And with any public health crisis, we need all the hands on deck that we can possibly find. Everyone has to be at the table. The Department of Health and Social Services touches addiction in multiple divisions. We are working in as many places with as many leadership opportunities as possible. Our Division of Public Health has been hard at work taking a lead on this comprehensive approach to address the opioid crisis, and working with partners with the Prescription Drug Action Committee, now the Addiction Action Committee. The division and the Addiction Action Committee have been focusing on safer opioid prescribing and has formed a work group on non-opioid approaches to pain management. The Division of Public Health has been working on addiction prevention education in schools. And in the general public, increasing knowledge and the ability to safely take back prescriptions when they are no longer needed. Our Division of Public Health, along with our Division of Substance Abuse and Mental Health, has also been leading the state's efforts to increase access to naloxone, because we need it in the hands of first responders and community members. We need to increase the awareness of the dangers of substance abuse while pregnant, working in the office, at restaurants, and we were working with Help Us Here website and campaign to increase prevention, recognition, and the treatment of addiction. The Division of Substance Abuse and Mental Health has been working to increase access to treatment. We know we need more. We need more in as many places as we can get. And we have to base it on the scientific evidence of what treatment approaches are the most effective and data-driven. This is about preventing overdose. This is about getting people into treatment that works. This is also an emphasis on increasing access to medication-assisted therapies, or we shorten it MAT, but also recovery housing, wraparound services, and we need to make sure they're necessary and in place to support the whole person and the family when they're ready for treatment and recovery. We also need to make sure that it's ready to help people who are incarcerated or re-entering into their communities. Our Division of Substance Abuse and Mental Health is constantly assessing the system to better understand where the gaps are in treatment system and how to meet the needs of individuals. And we've added treatment capacity, but we have a lot more to do. And to get to that gap that we identified, that more people need access, we also need more providers who are willing and able to provide that therapy. The Division of Substance Abuse and Mental Health is working with clinical partners, advocacy groups, federal and state partners to complete a full review of all of the treatment regulations in place in the state to ensure they will result in the best possible outcomes for Delawareans. This is about saving lives and about helping people where they're at. And we need to decrease the barriers, and we also need to leverage all of the evidence that is out there today. As part of a national workforce facilitated by the National Council of Behavioral Health, the Division of Substance Abuse and Mental Health, and the Division of Medicaid and Medical Assistance, we're working to reduce the barriers to prescribing buprenorphine. Currently, there are more than 2,000 Medicaid enrollees utilizing this approach to treatment. We need more PCPs, primary care doctors like me, prescribing this in their offices, providing that wraparound care with counselors who are in the office, providing a true behavioral health medical home. Our Division of Medicaid and Medicaid Managed Care Organizations actually eliminated prior authorization requirements for medication-assisted therapies in July of this year to decrease those barriers. We have to do more, and this is about reducing overdose. This is about getting people into therapy when they're ready. We have more plans underway to address the serious combination of opioid and benzodiazepine use. And we recommend that we need to do that through provider education. Doctors are doing things because they've always done them the same way. We need to work with them to get better systems and data into their hands so that they know when their patient may be at risk. There is more to do. Right now, our treatment system too often treats a problem, but not the person. And DHSS is working hard to evolve the treatment system so it's comprehensive, coordinated, high quality, and person-centered. We need to not focus on the where this happens, but what happens, how we provide that care. It's not about buildings, but how we make sure that people are safe to leave those spaces and can live in the world and work and be productive members. One in which these individuals are engaged into treatment, or sometimes forgiving and back into treatment at opportune times. One where there's a warm handoff, a person-to-person conversation to treatment from an overdose or identification of a substance abuse disorder, and no wrong way to enter into treatment. We've been working hard this summer, and I'm pleased to extend an invitation to the Department of Justice or anyone who wants to come to the table as we work to build centers of excellence in our state that include comprehensive evaluation, including trauma assessment, access to medication-assisted treatment, group and individual counseling, access to peer coaches, case management, and provision of links to primary care and mental health services so that addiction isn't treated in isolation to everything else, but you can take into account the entire health picture. We also need to provide links to recovery and transitional housing depending on where people are, and vocational therapy and more. Those social services, those social determinants are most important. We have to evolve in how our SUD treatment system is managed by expanding access to it, making sure that the capacity is there. We are not going to recruit more psychiatrists to our state to provide that mental health treatment separate from the rest of the person. How do we create a system that's person-centered, comprehensive, coordinated? It must evolve by making sure that we are also paying for services that are evidence-based and set expectations at the state level that allow our treatment partners, the people who are actually treating people, to manage their individual cases with those expectations in place. Through this mechanism, the state can monitor outcomes and pay for them, pay for better quality. The recently formed Addiction Action Committee, a group that grew out of the Prescription Drug Action Committee, will continue good work with prescribers. The Department of State and Medical Society of Delaware will expand information on safe prescribing practices, including addressing a key point made in these recommendations about the concerns of co-prescribing. We have to work with the providers. Funding by the Center for Disease Control, the Division of Public Health will also provide new support and training for prescribers this fall on how to use the very latest opioid prescribing guidelines, treat for chronic pain, reduce the risk of overdose and addiction, and use medical education webinars and materials and tools, which are also on our Help Us Here website. These efforts will be coupled with the new Department of State prescription drug regulations adopted earlier this year and revised to be launched in November. I am encouraged today we're highlighting the importance of naloxone. That's critical. We have to lead efforts to increase access by first responders, school nurses, and community members. And funding to naloxone has been from various places and not as well coordinated as it could be. We're working to implement a sustainable source of funding for naloxone, including seeking federal funding and exploring insurance reimbursement. DSAM, our Division of Substance Abuse and Mental Health, will continue to provide funding for community-based training programs currently offered by Brandywine Counseling and the Division of Public Health to make sure the very latest training materials and information is available from the Help Us Here website. And Governor Carney signed legislation in July which cleared up the legal barriers to naloxone being available over the counter in participating pharmacies. Please visit www.helpusherede.com. On evaluating involuntary treatment for those who decline treatment, we do have to proceed with care and caution, as Matt suggested. We have commissioned a report on these options, best practices from other states, and an examination of Delaware law compared to other successful states in this area. We have to learn from other states who are doing this, craft a careful policy based on successes, tailor it for Delaware, and make sure it's meeting the needs of anyone who may be clinically declared a danger to themselves or others. I also applaud the idea of seeking insurance reimbursement for alternatives to pain treatments. A work group of the Addiction Action Committee, chaired by Dr. John Goodall, is working on just this issue and will be recommending science-based approaches to managing pain by the end of this year. Thank you again to Attorney General Den for the invitation to participate today. We are so excited to have a better understanding of the treatment options that are here in the state, but know we need to do more. None of us can address this complex and deeply challenging issue alone. I look forward to the continuing partnerships to evolve the treatment system in Delaware. Thank you.